Hopefully we'll have some other treatment options, definitely an evolution of treatment algorithm, I think, in the near future. And then everyone's working very vigorously to try to help develop better serologic biomarkers in order to have something in addition to the other tools we have now for a diagnosis and helpful with management as well.
Today we're sitting down with Dr. Karissa Gable to share an update to her i3 Health activity on CIDP. Hi, everybody, and welcome to today's interview. Today I'm joined by Dr. Karissa Gable, who is a professor of neurology at Duke University Medical Center. Last year, she served as chair of our activity, Enhancing the Patient Journey in CIDP, Strategies for Improved Detection and Individualized Management. And today she's here to share some additional updates that have occurred since recording the activity. Dr. Gable, thanks very much for joining today.
Thanks for asking me to join. I'm happy to do a few updates since the activity launched in November. So the main thing that's happened in the interim is a definitions paper. So that is something that the GBS CDP Foundation helped support a collaborative, which was a consensus meeting of experts from around the world. And we all met in Boston last year in order to come to a consensus about definitions for CIDP, which hasn't yet been done, with what does remission mean? What does refractory mean? What does an optimal response to treatment mean? What is the definition of stability? And so it's so important because when we can actually come to an agreement, which we did, on those definitions, that informs going forward how we categorize patients in clinical trials, how we think about patient care and management. So I would recommend taking a look at that paper. It's going to be imminently published in the Neurology journal.
Awesome. We'll definitely have the link to that paper in this article. And yeah, that's amazing to be able to have those definitions so that treatment can really be individualized once you have those standards in mind.
Mhm, mhm.
Awesome. And looking ahead, are there any trials that you're anticipating seeing results of in the near future? Any other research coming out?
Yeah, so there's still some, research into the different clinical trials that of medications kind of coming down the pipeline. So we still have a couple FcRn antagonists drugs that are still in trials, and we're waiting for results. The nipocalimab study ARISE, so we're waiting for the results of that. The 1402 molecule is enrolling for that. So those are the two FcRns. Of course, within the complement kind of area mechanism, there was a sort of an unsuccessful result with the mobilized study, which was the riliprubart study with refractory patients versus placebo. And so they decided to stop the trial due to seemingly futility based on the data monitoring board, and there was press release related to that. So while that's unfortunate, I think I have a lot of hope for seeing the results for the Vitalize study, which is the riliprubart versus IVIG study. So that's ongoing with enrollment. And then there's also the other two complement inhibitors with empasiprubart and the Energize and Invigorate study, and then the Captivate study with claseprubart. And all of those we outlined in detail in this activity, so you can take a look at that.
Awesome. So with all these evolving research areas, what are you most looking forward to seeing in the future of CIDP treatment in the coming years?
Well, hopefully we'll have some other treatment options, definitely an evolution of treatment algorithm, I think, in the near future. And then everyone's working very vigorously to try to help develop better serologic biomarkers in order to have something in addition to the other tools we have now for a diagnosis and helpful with management as well.
Awesome. So with all these, new treatments that are coming down the pipeline, what is your approach to selecting the optimal treatment for individual patients, and how do you involve them in shared decision making?
So that's a good question. What I discuss with patients wherever they are in their treatment journey, what the available options are, the risks and benefits of the treatment, talk about potential side effects, and then on an individual basis, talk about the best option for them, considering lifestyle, other comorbidities, willingness to, and preference for certain like routes of administration. And some treatments can have they're decent, like equal efficacy for the most part. I think so. It's not really a lesson. What's available now is not really necessarily a limitation of efficacy, but there are patients who don't respond to some of the first line therapies. So we have to discuss that too. So we can take all that information together and talk about that, making a decision kind of mutually to figure out what the best option is for patients.
Great to know. Awesome. So as we wrap up with this interview, for learners who have not yet completed the activity, what are some of the most valuable practical takeaways they can expect to gain from it?
I mean, I think this is a really comprehensive activity. So, in essence, you have, a detailed dive into what diagnosis involves and recommendations for using the guidelines from the EAN-PNS 2021 guidelines to help with diagnosis and also management. And then the current treatment algorithm as it stands is there. And then we talk about management and upcoming potential therapies. So it's a pretty comprehensive activity. I think it's really great to take some time to do that to understand CIDP a little better.
Amazing. Well, thanks very much, Dr. Gable, for coming on today and sharing these insights with us. And to everybody listening, be sure to visit itherhealth.com to view the full activity and claim your free credit. Thanks again.
Thank you.
Thanks for watching. If you want to keep following these oncology insights, go ahead and click right here to watch our next story and dive into the latest clinical breakthroughs on our channel. And before you go, make sure to hit that subscribe button so you never miss an expert update.